I'm going to hopefully actually be short of the time and keep us on track. But I want to thank, honestly, I feel like I want to thank Debbie and Dr. Gentile for taking the leap of faith to invite me out here. It really is due to Veronica inviting me down to Louisville, where I met Matt. And here I am. So if you're wondering why a person, former runner, marketing person is standing at a medical extended learning opportunity for you. So I'm going to change gears a little bit, and I promise there won't be a lot of slides. I will say, I don't think I need to share any more information about air pollution's bad for us, and we have too much. And so kind of dispense of that. But it's an interesting situation to come from Portland, Oregon, and be talking about air pollution and the advocacy work. We created our organization in 2010. And we were really determined that the already existing 15,000 nonprofit organizations, of which a good 30 to 40% of them are focused on the environment, not a single one was working on air quality. And was that a signal, or was that a niche opportunity? And being the marketing person, I decided to go for the niche opportunity. Why wasn't anybody working on air pollution in Oregon? Is that because we don't have an air pollution problem? And actually what we learned was, it's not that we didn't have a problem, but it is a very technical and highly specialized area, and there really wasn't a lot of the focus on it. And what we have in Oregon is really a perception problem, and particularly in Portland, Oregon. And so that's what I found was our primary need and opportunity, if we were going to address the problems of air pollution, was to look at the idea of people's perception of what air pollution is. And what we don't have in Portland, and not in all parts of Oregon, we have some maintenance and some issues around NAAQS standards, the National Air Quality Standards, where we do have with particulates and ozone some historical problems with that. But the reality is we do meet most of the federal standards. And so the question is does that mean that then the air is safe and that it's okay? And so what we actually realized, though, is that most of those federal standards, and I was able actually to astound Phil that we only have one federal reference monitor in the Portland metro area. So is that adequate to tell us that my neighborhood, that is actually abuts what we call the industrial sanctuary, it's a designated heavy industrial area, and it's obviously fed with a massive transportation network, does that mean that my air is safe to breathe? And so a big part of the issue that we had was to really bring the concept of air pollution to a very localized concept so that people could understand that their air quality is really only as good as it is on their block, not necessarily what the regional numbers might tell us. So this was my gateway into the issue of air pollution. It was a study done, published by USA Today, in 2008. I actually didn't come across it until I call myself an accidental activist, because the whole way I got into this was I was Googling the farm to lunch, school lunch program, and instead I came up with the Industrial Air Pollution in America's Schools study that was published by USA Today called the Smokestack Effect. And this study actually took EPA toxic release inventory data, and it took the risk assessment data that looks at the relative toxicity of individual pollutants. And the University of Massachusetts Amherst scientists group that they worked with actually used geographic markers of America's schools to come up with aggregate loads of pollution in highly localized areas. So this is what was the game changer for me, my neighborhood first, my community, my school group, and then the broader Portland metro region, was to actually look at our schools and the impact that industrial pollution alone was having in our neighborhoods. So for example, there's an area to the left of the river, stage left. The left of the river, and you see a couple smokestacks above it, and you see a whole bunch of ones and twos. That's basically my neighborhood. It actually is one of the highest density residential neighborhoods in the Portland metro area. It's the wealth ratio is pretty high. We have pretty high socioeconomic indicators in this neighborhood. But again, it does abut that industrial sanctuary, and we have a large steel manufacturer that's based right centered in there. And so what happened was, suddenly looking at our air pollution problem on a national scale, what these numbers indicate are the rankings that we are on a national level. So that basically my daughter's school that they were going to was ranked in the bottom 2% in the nation for poor air quality due to the aggregate industrial toxics that were near the school. But we also saw that pretty much the whole city, up in North Portland, up along the river, up higher, were some of the worst numbers as well. And pretty much nobody in the city of Portland, no child, no neighborhood school was better than the bottom 30% in the nation. So this was sort of a game changer. It certainly motivated my neighborhood, and we got very motivated to go after this problem and to see, first and foremost, why does this exist and what can we do about it? At the same time, as Matt said, I sat on an advisory committee I was invited to sit on called the Portland Air Toxic Solutions. And this is something that was happening. The advisory committee met from 2009 to 2011, and they were looking at area-wide emissions, and they actually did an emissions inventory across the whole Portland metro area. This just happens to be the one map for the diesel particulates. They actually looked at 15 toxics, individual toxics, that all exceeded the health-based benchmark of more than 1 in a million cancers. The level's high enough to cause more than 1 in a million cancers. But diesel particulate really stood out among the rest of them in terms of the risk that it was posing to a wide group of people. And what we actually knew from NADA, the National Air Toxics Assessment data that EPA provided, was that Oregon, actually, our diesel emissions were ranked in the top 6% in the nation. And our Multnomah County, which this map basically represents Multnomah County, the county that surrounds Portland, we were in the top 4% of diesel emissions in the country. And now the latest NADA data also indicates that we have the highest amount of respiratory distress in the nation due to the ongoing toxic, mostly caused by diesel pollution. And so what we also realize is, besides for this city where we actually have what we call the urban growth boundary. What we've done is drawn a big circle around our urban area and said, we don't want to have sprawl and growth because from a climate standpoint, that's problematic. It makes people drive more. It's not good for our cities. But we've then basically encouraged all this high-density residential infill around what was traditionally a industrial working city, and where the confluence of basically all West Coast regional freight transportation cuts through our highest residential areas in our city. And so it leaves us with where we've brought more people to the problem, and we've concentrated our populations at the center of where all the pollution is. So this is a really big problem. I'm just a mom. I came across this, on my computer, and I'm trying to deal with the fact that, wow, I've got these big industrial polluters in my neighborhood. What am I going to do about that? We've got area-wide diesel pollution. What can we do about that? And just a few of the facts about it. But, basically the picture of industrial air emissions, the reporting to TRI, 271 Oregon facilities, 18 million pounds of toxic chemical releases. The other thing about air pollution and the industrial pollution, and I probably assume it's similar here, what we found during the years of the deep recession to now is that basically air pollution is indexed with economic growth. There's no separation between these two. And that's different than our carbon emissions historically in Portland, where we've actually seen reductions in carbon 18% below our 1990 levels already. And we have seen growth in our region and our carbon reductions going down. So it is possible that these things don't have to be connected, but with industrial emissions, we really have not separated these indices. So just in Portland, the 1.7 million pounds of toxics released into the airshed. And what we know is those are not all spread about and shared equally. Basically, the closer you live to a facility, you get a bigger portion of that pie. The diesel particulate, as I said, 6th highest in the nation, and we were ranked number 1 in respiratory distress. So it's a big problem. We also know air pollution, I won't get too deep into this. You guys know way more about it than I do, but it is linked to asthma, and we have the high asthma rates in our metro area. We pay a big cost for that, 20.7 billion, I guess that's an American number. We also know that it's linked to premature birth and the rise and increase of problems of autism and the ADHD and the learning disabilities. And these are all, and I brought up these problems because these are all prevalent problems that our public health officials are trying to work on constantly and that really affect our populations. And as well, our Multnomah County recognizes that air pollution is linked to the top 3 leading causes of death in our region. So again, what are we doing about it? It's a really complicated system, and I think that's one of the problems and why there hasn't been a lot of deep advocacy on air pollution, because when you try and look at, understanding what the mechanisms, how it's regulated, it's a really complicated system. We look out, we see air, but regulators look out there and they see lots of compartments of very individual sources and ways that they address the air pollution problem. Pretty much Oregon's program mirrored the federal government's program, except on the areas of climate and carbon, where we were really aggressive and we've done really good work. But in the world of air toxics, we really had done almost nothing to move ahead, other than we did the Portland Air Toxic Solutions Emissions Inventory, which was a very progressive understanding of the problem, and we took no solutions or actions after that. So we were kind of on our own. So our work started with, basically addressing the polluter in our neighborhood and realizing that regulations weren't going to help us. The pollution was legal. They were compliant with their permits, and we were going to have to address the problem ourselves. But how is this going to deal, with the bigger issue of changing the system, the strategic, what did Veronica call it, the strategic systems change that we need, when you have a general lack of awareness, because it's very, very difficult to enumerate the problem, because there's very little monitoring and information, and there are no enforceable limits once you actually enumerate the problem. Anyway, pretty much air pollution is all 100% legal. And finally, what we rely on with the AIR program is technology standards that really aren't health-based standards, even though we all look for the program to actually protect public health. So I'm going to play a quick video if I can figure out how to get to the other screen. So basically, what that is demonstration of the #1 edict of PR is never let a good crisis go to waste. And so, that was what we needed. So we had been toiling away. We had identified the problem. We had regulators who were recognizing the problem and enumerating it to a certain extent. But what we didn't have was that critical mass. And so what I'd like to get to now in the sort of second part of the talk is sort of, okay, what are we going to do with this opportunity? What do we need out of this opportunity? And I've always loved this Sandra Steinberger quote, and I think it's no more relevant than it's ever been today when we consider what's happening at the federal level and with our Environmental Protection Agency, that, basically parents have become our own regulators. And, a lot of that has been related to the issue around toxics in the products that our kids use, but it's also, in the air that we breathe, that, that we've basically had to be the impetus and identify the solutions for these problems to protect our children. And it's been, I think, the hardest part, and it's very exciting to be here today in a room, full of, smart health and clinicians, is because we've rarely had our public health and our medical professionals on our side, because it's been a very difficult problem to make these connections and to demonstrate the intersections of the health of our environment and the problems that we see with our kids. And the lines it's not linear, but as parents, I think we have that intuitive, I really appreciated what the speaker before me said about, the precautionary principle. It's always, less is always better in the case of risk for our children. So our challenge last year, though, was to take something that was ostensibly about colored glass manufacturing. I mean, that was the big, and I think the surprise that this was about artisan colored glass shops was a big part of the impact that it had on our communities, because these are the kinds of things as I said, we're an industrial working town. We have an industrial sanctuary. We've got tank farms. We store all the regional fuel supply in 8,364 tanks that I can see from my window. We've got a shipyard in the a mid-century shipyard in the middle of the city. We are used to industry. We didn't expect it out of glass manufacturing. And I think, but what we really had to do was make sure, though, that this moment just didn't become a colored glass manufacturing rule, which there was definitely a lot of impetus. And within 6 months, we had written a new colored glass manufacturing rule to address that unique problem. But we really needed to make sure that we got a bigger systemic change and solution to address the bigger risks that we had. And I know that there's a lot of distinction people like to make between diesel or transportation and industry, but for me, the two are really related, at least in Oregon. They both are, gaps in the Clean Air Act. They're both diesel pollution, like industry pollution, is not regulated to a health standard the way we have our NAAQS standards for 6 pollutants that are regulated. Diesel pollution does fall generally, the most dangerous diesel pollution falls under that 2.5 into ultrafine, and so it's not measured well. So even when we can say we're NAAQS compliant with our 2.5, that doesn't really give us much of an indication of what the ultrafine particulates that we're breathing, and that our high diesel pollution probably indicates that we would be, look much worse in. And diesel pollution is not addressed because of industry's work and fight to make sure it isn't. And it's very similar in Oregon. These blocks work together, the manufacturers and the transportation and general contractors. So we needed, though, to make sure, we really wanted to make sure, though, was that if our state was going to address the risk of air pollution, if there was this impetus to look at the health problem and the risk, and that we had sort of a metric now that people were utilizing because, MOS concentrations and follow-up air monitoring showed that cadmium and arsenic were at certain levels that, created risk of cancer, that we could put those numbers against also the diesel and all the rest of the pollution and make sure that we said there's as much urgency to address this. Because one of the problems is where the trucks are and where the heavy industry is, there aren't a lot of trees with moss. So the fact that moss really highlighted these very local, smaller, neighborhood scale glass manufacturers was really also an indication where the moss was, not where the pollution was. So I will tell you that the way that we did this was building constituency and building the political will. First and foremost, again, I've always felt like this problem really hasn't been an issue of technical. It hasn't been an issue of not knowing that air pollution is bad. It hasn't been really a technology problem. It's been a political problem for us, certainly in Oregon. Up to the top left on this picture is our Multnomah County chair of Multnomah County. They are the local health authority, the health board. I've spent 7 years sitting on committees at Multnomah County on this problem of air toxics. So while we were really excited that our county kind of brought the city on board, and we had strong statements from the county and city to say, we're going to do something about air pollution, that was based on 7 years of institutional work to bring these guys up to speed and to educate them on this problem. And it takes a lot of time to build that kind of political will. Likewise, the governor, this is the first governor that we've had. I've had 3 sitting governors. One was actually a physician, could never get their attention, even though they were the only elected official that actually has authority over the regulators and over the problem of air pollution. And so we work very closely with schools and kids and bring these people to our elected officials and give them opportunities to demonstrate their commitment to children's health. And that's a really key piece of it for us, is working with our elected officials and giving them positive opportunities to demonstrate their commitment to children's health. This actually happened, these are all from this year, from work that we did at the state legislature on diesel, as well as what we're working on in a rulemaking process that I'll get into in just a second. So I will tell you, I started this work in 2009, just as a local neighborhood. 2010, we founded our nonprofit, and in 2013, I registered as a lobbyist to basically be able to go down and work on, with our elected officials. Because honestly, again, this is, the political piece of this is really the problem. And it's interesting for me to hear and be here and just see, for me, trying to sell the work for air quality in Oregon sometimes feels like selling sand in the desert. I mean, people don't see it. I'm astounded to come to Pittsburgh and kind of hear the exact same sort of reticence and the problem that you face here to kind of convince people that there is an air pollution problem. But I will say we had that same, trying to talk to a mayor and trying to talk to our local officials and even our governor and convince them that there is a real problem took a lot of long work. And I will say, I think that when the medical professions and the public health people come along by your side, it's a massive boost. And I think it's great testimony to have events like this to really help educate and bring more people's voices to this work. So what happened then? Basically, after we pivoted and we made sure that this wasn't going to be just about colored glass manufacturing, but it was going to be an overhaul of the whole system, we lost one battle really early, and that was basically that our governor said, you know what, I'm going to Cleaner Air Oregon, we're going to establish a program that's going to be a joint initiative between Oregon Health Authority and the Department of Environmental Quality, our regulators, but we're going to look at the permits only. We're going to look at industry only, and we're going to go to the state legislature and ask them to deal with the diesel pollution through diesel engine standards through state mandate. So we kind of lost that battle a little bit, but we did get a complete overhaul of the permitting program. And basically, I don't know if you guys can read this, but the whole idea about the new permitting program for Cleaner Air Oregon is to establish health-based standards. So it's to move it off of the federal replication of technology-only standards and to actually create health-based standards, meaning that, this much pollution is not okay, and so then it's up to the compliance. Technology has to meet that standard. It doesn't stop at the highest technology standard. So we're going to set limits for the industrial sources based on human health, so there will be risk assessments for every facility. They also have to do a reporting now that is much more extensive. They have to report on 676 different toxics, which is above, what they were reporting on, I think, was 64. TRI only requires them to report on the ones that are more than 10,000 pounds or 25,000 aggregate. And so now they have to report at whatever level. There's no de minimis exemption of any toxics that they release. So that goes into a transparent and open inventory that can allow us then to create a risk assessment and aggregate for the total risk of a facility. We're defining exposure levels that are protective of human health based on human health safety standard. And what that means is basically we're using the modeling of human receptors that would be most impacted by a facility or multiple facilities and defining the health by defining the risk standard at that human receptor. And then we're basically, so the capture rate of this program is much broader than what we've had previously. Pretty much there's no facility that's too small to be in the program. Everybody has to, at least from the reporting and the initial risk assessment before they're off-ramped, they have to be in the program and have permits. So this just gives you a little idea, frankly, of my life over the last year and a half. This is a calendaring of how this program has moved forward. It started out with a deep dive into, they brought in about 20 people from across the country from 6 different state programs that had the, kind of best practices across the states programs, and took a look at what the best practices would be. And that was in what they called their technical work group that met last summer. Then we've gone through, since October, we've had a 24-member stakeholder committee that has been reviewing all the program elements that the agencies are considering proposing in the final rules. And that's been, they counted up for us. We just convened our last meeting, and they counted that we had, over the last 9 months, sat through 55 hours of meetings, and reams and reams of the 24 different elements that are going to be in the final program. This will all go out for public comment this fall. It'll be reviewed, and then it will be put in front of our Environmental Quality Commission that makes all the rulemaking decisions for the agency by next summer. So we still have a long way to go before these are implemented and in place. I will say what we're really focused on out of those 24 program elements, the things that we're most focused on are the community engagement. How do communities really understand their risk? How are they brought into the process? The health-based, really making sure to double down on that health-based versus technology-based. It's really easy to kind of slide back to just, well, we put TBACT in place. TBACT is, best available control technology, so can we really ask them to do anything more? I will say, in the case of the glass manufacturer that was at the center of all this, they met TBACT very early in on this process. They had had no capture device. They put 4 bag houses in. They met it, and they were doing great, except for their Chrome 6 emissions were still coming out after meeting TBACT, after meeting the highest technology standard. And you know what? The governor issued a cease and desist. There's a daycare center across the street and said, nope, you've got Chrome 6 emissions coming out of your facility still. And because of that impetus, within a month, they had actually come up, the reason they created Chrome 6 was because of chromium that they used to make green glass. They found a different way to make green glass, a different chemistry, and a month later, they were able to actually say, you know what? We can change the chemistry, and we're not, and the monitoring that's been done at their fence line demonstrates that they are not emitting Chrome 6 anymore. So I think it's really important for us to stick by these health standards, because a technology standard is always going to have a limitation, and without the impetus to actually meet that health standard, they're probably going to stop where they can. Cumulative risk is a really difficult topic. There's a great program in Minneapolis and Minnesota. We had the woman come out and tell us about it, but it basically takes in all the background. It's the idea that you're going to consider what other pollutants a person is exposed to besides maybe just the facility, and make a determination about how the facility's emissions should be reduced in order to address that cumulative load that a neighborhood has. Because generally, without those area caps, without that idea of everybody should have safe air no matter where it's coming from, it's too easy for folks to kind of say, well, proportionately, we're not a big part of the problem, so why should we have to invest a bunch of money at this facility to reduce pollution if we've got a freeway coming through and there's a problem there? And so we're trying to make sure that facilities aren't using background pollution as an excuse to pollute more, but actually as an excuse or an impetus that's going to require them to be more stringent. We're still fighting a little bit on the tiered program of how they're going to address and bring in facilities, and the data information, quality, accessibility. We're still, the last 2 things are probably the most political, because they all have to do with the agency's budget. And I have to say, one of the unfortunate things is, and it happened this last session, is that the legislature was meeting while we were doing this rulemaking process, and the legislature is going over the agency's budget, and the rulemaking process is determining what the rules look like. And I will tell you, where industry was losing at the rulemaking table, they were winning in the state legislature by putting so much pressure on. And we got 0 funding for this program out of this last session, which was very disappointing. I will tell you, from our standpoint, the advocacy standpoint, we realize this is not, our job doesn't go away, it actually gets more important. We're going to have hopefully more tools in the toolbox for communities, and we've created a partnership with our Portland State University researchers and Lewis and Clark environmental law clinics that we're going to continue to try and build the capacity of communities through access to legal and technical assistance for the work. And so I just want to say thank you. I want to thank, again, Dr. Gentile for bringing me out here, my contacts that helped me make it out here, Heinz, Phil, it's been great to meet you, and I thank you for your support of this. I think it's amazing work that you guys are doing, and it's really important. So thank you very much.